Welcome to the New York City Health Data Tour 2026. From the New York City Health Department, I'll be joined by Alexa, Hillary, Casey, Martha, and Sarah, and I'm Emily Torum. So, quick overview of our agenda. We'll be going over some NYC Health open data resources, as well as some other data products, including Epiquery, community health profiles, the Environment and Health Data Portal, the Respiratory Illness Data Page, Provisional Births and Deaths Page, Vaccination Data Explorer, and we will wrap up with opportunities and some time for feedback, comments, questions, and conversation. Great. So when we talk about data, we want to kind of expand beyond the scope of data just as numbers and as facts. We want to think of them as knowledge, and the knowledge that we create is the most powerful when we do a good job sharing it. So some of the ways that we do that we'll explore today include through narrative, through interactivity, through data visualization, and all of these powerful ways that we can really communicate the meaning behind data. So what are some of the types of data we'll talk about today? So we'll talk about survey data, disease surveillance data, vital statistics like birth and death records, operational data, and so much more. There are so many kinds of data. And I will pass it over to Martha to talk about inequities in health data.
Thank you, Emily. We're really lucky to have so much robust local data that can be used in so many ways. And I see another one of our colleagues on the call who works with several of our community health surveys. So it's cool to see that it's a big part of our work at the health department, and also working to call out inequities in health is a big part of our work. It's especially important when it helps us to see how persistent structural and institutional racism, which are rooted in white supremacy, have led to inequitable health outcomes across the city. I'm really guided by the words of our former health commissioner, Dr. Mary Bassett, who said that we should be making a deliberate effort to name and address health disparities. And she urged us to remember that inequities in health are unfair, unnecessary, and avoidable. I'd like to show you an example of how much our health can vary by neighborhood on the next slide. Life expectancy is from our vital statistics data. It's a data point that we use to measure premature death. It's related to rates of disease and poverty. So this map shows rates of premature death by community district in New York City up to 2013. Note that the community districts are just one way that we measure neighborhood health. It's one of our mapping schemes. So when you're looking at any of our data, it's important to know which geography it's using. This one is using community district data, and some will use United Hospital Fund neighborhoods, zip codes, and for the period shown anyway, the neighborhoods with darker shading have higher rates of premature death. Lighter shading have lower rates of premature death. And in the differences in the neighborhoods, we can really see the neighborhoods with the worst health outcomes were the ones that were historically redlined. They were seen as undesirable places to live, and having fewer financial resources in those neighborhoods led to negative health outcomes, which are still being reflected in the health today. So as we look at the data today, our open data and the resources from our website, just keep in mind that the health outcomes we see are not the result only of individual health behavior, but also that it's determined by past and current discrimination and conditions around the city. So the first stop on our data tour is the health department data on the NYC Open Data site, and this will be presented by Sarah Permit.
Thanks, Martha. Hi, everyone. My name is Sarah Permit. I'm the Open Data Coordinator here at the Department of Health and Mental Hygiene, and I'll be talking about our open data. You're likely all familiar with open data, or you'll be learning about it this week. Open Data Local Law 11 went into effect February of 2012. The law requires all city agencies to make their public data available online through an online open data portal. Written here is the Open Data Local Law 11 itself. Essentially, if there's public data that is found on any platform on a New York City Health Department website, it must be publicly available on the New York City Open Data site. Later, there were approved amendments put into place in 2015 that included retention and archiving, data dictionaries, geospatial standards, public requests, and timely updates. Now let's get into open data usage. Department of Health has 80 datasets on open data. Since the Open Data Portal was launched, our agency has amassed over 1.8 million views and nearly 6 million downloads globally. As you can see on the heat map to the right, New York City Open Data is used worldwide, reporting about 600,000 users in the US, which are tracked by unique IP addresses. Our data is used heavily in many countries outside of the US, including countries like India, China, and Canada. And open data is used by many individuals. These individuals inform community awareness, politics, and even enforcements. As of this year, we're currently ranked 7th out of the 88 agencies on the Open Data platform for visits, and we're first for downloads. On this slide, I'd like to highlight that among our 80 health department posted datasets, these are our 7 most frequently accessed by visits. So first is the restaurant inspection results, followed by leading causes of death, COVID daily counts of cases, hospitalizations, and deaths, air quality, popular baby names, COVID concentrations measured in wastewater, and finally our dog licensing datasets. And on the next slide, I'm going to do a demo. This is our landing page, the open data site. Hopefully you've seen it. So I guess it's only Monday, but so far this week. So here's where citywide public data can be accessed, including our agencies. So I'm going to scroll down the page to sort the data sets by agency. These are all of our city agency data sets, and I'll select Department of Health and Mental Hygiene. And here are our data sets. I'll sort by most viewed, and I'm going to select one to do a brief demo within it. I'm going to go down to rodent inspections. That's the one we'll look at today. So this is the landing page under the About tab, and it shows some information about the data set. So you'll see a detailed description here written by the data steward. And then if we scroll down a little bit, more information that would be useful about the data set. So like how frequently it's updated, it's automated. We have attachments that are very useful. So many will have a user guide and a data dictionary that will help you understand the intricacies of the data set, as well as definitions that are included here. I'm going to navigate to the data tab, and this shows all of our data. So this is the data set for rodent inspections. There's a lot of good information in here. Lots of geographic information, the coordinates if you're interested in geocoding, as well as the actual results of the inspection. I'll show you very briefly how to do a query. So let's say, for example, I'm interested in all of the rodent inspections in a certain neighborhood. I'm going to filter by NTA's a neighborhood tabulation area, and I'm interested in the area around our office. We're located in Long Island City. So I'll put that in. Neighborhood tabulation area is one of, I selected Long Island City, Hunters Point, and click apply. And my query is done. It gave me a success message, and I have all the information of all of the rodent inspections in just, it's highlighted here, Long Island City. And so if I wanted to, if I had the time, I could go further into specific building area, specific zip code, and look at all of the rodent inspections and even filter for a certain date. I do not have the time to do that today, but I encourage you to get into the platform and look for yourself. And then there's also, stop sharing, a class every day this week as part of Open Data Week called Discovering New York City Open Data Introductory Classes that can get you a lot more information on how to use the portal. So over the past few years, we have several data sets from our agency. So we had 56 in 2020. Today we host 80, and we're on track to host 94 by the end of this year. Of course, this is always subject to change as we get more data requests and post more data on the portal. And on the next slide, it shows the number of data sets we have by division. And we have the biggest divisions that post data sets are disease control and environmental health. So before closing my section, just want to raise your awareness that similar to OTI, Department of Health has an open data team. I'm the open data coordinator, as I mentioned, and I coordinate the requests. So if you have any questions, comments, or concerns, please reach out to myself or OTI with the contact information posted on this slide. And I will pass it off to Martha, who's doing the next section.
Awesome. Thank you, Sarah. So now that we've looked at the open data, our data available on the open data site. The rest of the data that we show you for the remainder of the presentation will be on the health department website. You can find all of them starting at nyc.gov/health/data. Our tagline is hundreds of stories, one place to start, because we want to make it easy to translate data, find data, translate data into stories, and to bring awareness to inequities across the city. So the little picture here is just a little screenshot of our data homepage. And from that page, there are 3 options. You have Interact and Visualize, where all of our interactive data tools are housed. We have EpiQuery, the Community Health Profiles, and the Environment and Health Data Portal, which are all larger tools with lots of different data sources. Then we have several topic-specific data tools, which have more specific purposes with very targeted data sets. You'll hear about 3 of those today: birth and death data, respiratory illness, and childhood vaccination. And there's a new one also that was just put online recently about drug testing. So that one we encourage you to check out as well. Each of the tools is different, but the goal is the same: to get data to the people, to researchers and students and journalists and anyone who wants to use it. The other sections of that homepage include data sets, where we have lots of data sets for surveys and other activities. If you ever want to look at a survey questionnaire or learn about the history of a survey, you can find it there. And then finally, we have several series of publications by health department authors, several series and using health department data, health department studies, and then some special reports that come out about once every year or 2. The most recent one was on the health of immigrant New Yorkers. And later this year, we'll be releasing one on the health of Black New Yorkers. So I'm going to tell you about EpiQuery and the community health profiles. And then we'll have just one slide on each of them, and then we can look at them online. EpiQuery is the summary, a tool that presents data from different sources all in one place. It includes data from surveys, vital statistics, and surveillance. A lot of folks use EpiQuery to look at data from our community health survey, from the Youth Risk Behavior Survey, or syndromic surveillance hospital data. We can use it to analyze by demographics, compare neighborhoods, and look at trends over time. The community health profiles on the next slide were designed to show that our health starts where we live and work and play in our neighborhoods, and really give us a better sense of the challenges and assets in each community. They're developed to show health in each of the 59 community districts across the city, and the health measures are organized into sections by topic. So I will share my screen and show you how these work.
Thank you, Martha.
So the community health profiles, and just quickly, if you were at the health department homepage, you could click on data here at the top sections, and then come to all of these options to learn more about our data tools. There's a link to community health profiles there. Or you could go to nyc.gov/health/profiles, which is probably the easier way to find it. So when you get to the community health profiles homepage, there are 2 steps to enter the profiles tool. One is to choose a community district. And let's go for, say, East Flatbush. You can choose it by clicking on the map, by selecting from a drop-down list, or by entering an address, and it will pop up with this correct community district. There's a map error. All you have to do is click the X on the map error. So I chose East Flatbush, and then you select a section to move into the profile tool. The topics are organized starting with social determinants of health and going into some health behaviors. I will choose healthcare. You can see that some of these have plus signs, and that means if you click on it, it expands into topics. So I chose healthcare. I'll click on access to care. This takes you into the profiles tool. And once you're in one of these profile screens, it's easy to return to start with the gray button at the top left. And then these blue bars across the top are the way you navigate. So they're the sections or chapters of the profiles. We're in healthcare right now. You can see the other topics: healthy living, maternal child health. This healthcare that we're in has 2 subtopics: access to care and then vaccination. The good thing about the profiles is it includes a lot of text, which is great, I think, for students. So just text interpretation, some background information. Health insurance can make it easier to get affordable primary care. There's some information like that. And then there'll be the data that we're wanting to look at. In East Flatbush, the neighborhood we chose, 17% of adults are uninsured, similar to the rest of New York City. And then we can see it down below in the table there. So there are a couple more features If we go back up to below the blue bars, there are 2 drop-down menus. We can do 2 things. We can choose a comparison community. So say you live or work in East Flatbush and you want to compare it to like a nearby neighborhood. So we could choose Bushwick, see how things differ in those 2 neighborhoods. So you can see that some numbers were added to the table. They're not added to the text, but they're added to the table. So, and then one other thing we can add is in the drop-down menus is to show the most favorable rate. And that's a yes or no. And if we choose yes, it will show us, in this case, the neighborhood with the lowest number of the lowest percentage of uninsured adults. So if we look at this table again, adults without health insurance, we'll always have the New York City number in the rust color here. The borough of the neighborhood we chose, Brooklyn. East Flatbush is the neighborhood we chose. Bushwick is the comparison neighborhood. And then the neighborhood with the most favorable rate, in this case, is the financial district. You can see that 2 of the percentages have asterisks. So there's an interpret estimate with caution, just a message for that. And then the data source and year is always underneath each data visualization in the profiles. We're in the process of updating these right now. So these numbers will soon be updated. The same health measures, just new data. So you can see how to navigate left, right to the different topics in the profiles. The button on the far right is maps. So I'll just click there and it just works in the opposite way. So you can start with a health. It starts in the community district you are looking at. It starts on self-reported health, but you can switch this to any health indicator and it will show you a map of the highest and lowest rates of whatever you're looking at. And then it'll list out the neighborhoods and list the rates by borough and New York City overall. So this is a great way to, if you just have a question like, which neighborhoods have the highest rates of whatever, you can look here and find it quickly. Our other data tool that I want to show you is called EpiQuery. And you can start at nyc.gov/health/EpiQuery. This is the EpiQuery homepage. And you can navigate by topic, and the topics are similar to what's in the community health profiles, or by data source, or by indicators. So basically by health measure. You can also search by indicator at the top right. I'd like to show you some data from the New York City Youth Risk Behavior Survey. So go to Source, Health Surveys, and then Youth Risk Behavior Survey. And I just want to show you how to navigate. It's similar to the community health profiles in that we have a lot of blue. The first page that comes up here is called an indicator list. And so basically this is the data, all the data from the Youth Risk Behavior Survey, the 6 most recent years that are in EpiQuery, which again will be updated soon as well. But you can see going down the left-hand side, there are each of the indicators for the survey. To move forward to look at more data, you can just click on any of these indicator names or any of the numbers. I'll click on the first one, which is got into a physical fight. And from there, we get to an indicator overview. Looking at these blue bars, we can see that we see the overview. We can analyze by demographics, compare 2 indicators. Basically, you can click on these blue bars to navigate left and right. And this indicator overview page is quite useful because it gives you an overall prevalence, a trend over time, and also the little definition of what it means. Were students in a physical fight 1 or more times during the past 12 months? And we have some demographic breakdowns as you scroll down. So there's really a lot of information even just on this overview page. So that's the basic navigation for EpiQuery and community health profiles. And that is the end of my section. Emily will tell you next about the Environment and Health Data Portal.
Thank you, Martha. So yeah, as Martha mentioned, I'm going to talk about the Environment and Health Data Portal. I'm the content manager for that site, and we are a small team, but we would love to hear your feedback, and I will place our general email inbox and sign-up list at the end of this presentation. So yeah, as I was talking about at the beginning of our presentation, within each data set, there's a story. Data are about people and their health and their experiences, and we use data inside a government agency to create knowledge. And because this knowledge comes from people that use our tools, we want them to be able to use our tools well. We want them to be able to understand data that describes them, their circumstances, their health, and all of these components that are so important to all New Yorkers. And we think this is our responsibility as public health workers. So to that end, on the Environment and Health Data Portal, which I'll do a quick demo in a moment, we try to make our data easy to understand, access, and use. That's our motto. And we use this data at not just us, but people outside of our agency, such as people from community-based organizations, educators, everyday folks use data to inform policy practice and just general understanding of the picture of health in New York City and how it's related to the environment. So I will demo our site. A quick note on our URL. It is a bit long. My preferred way of accessing the Environment and Health Data Portal is to just Google Environment and Health Data Portal NYC. It should be the first result. Alternatively, you can save this to your bookmarks. But yeah, it's a bit long to remember. So I'm going to, share my screen here. Can everybody see the Environment and Health Data Portal? I know I switched tabs. Yeah, okay, perfect. Great. So I'm just going to give you a very quick tour of how to use this website. So we have 4 main ways of exploring the data and content that we have here. So if you go to this Explore tab, you can see that there are data stories, and those are like short to medium form explainers about topics, and I'll show you what a couple of those look like in a moment. Data features, which are more interactive ways of comparing data sets to each other and deriving meaning from that. Neighborhood reports really help people compare a variety of indicators on a neighborhood level, and they really give you a snapshot feel of how a neighborhood is doing in terms of different factors. And then lastly, the Data Explorer, which has over 200 indicators that you can explore, and they cover many different topics. You can visualize that data, you can download it, you can use it for your own projects and do all kinds of stuff with it. So speaking of topics, you can alternatively explore our site through some of these key topics here. So we have things like accessibility and health, air quality and health, climate and health, food and drink and health, housing, inequality, and many other key topics. So if you're curious about something, you can go to any of these pages. For example, the housing key topic page, I'll just click on that. So you can see that this is just a sample of some of our indicators having to do with housing and health. We know that people that live in higher quality housing might have better health outcomes, might also have better access to quality health insurance and all of these other effects that are related and determine population health. So you get a quick overview of the topic here. You can click on neighborhood reports that are related to housing here. And then we also link to any relevant data features and data stories that have to do with housing. So some of these have to do with pests, some of them have to do with building maintenance and location related to flooding and climate. One of them focuses just on the myriad ways that housing quality can affect health. So yeah, that is navigating by topic. And next, I'm just going to show you a couple of our data stories and features. So this one you might be familiar with. This is the Interactive Heat Vulnerability Index. I think this is a really cool feature, not just because it's interactive and because it looks nice and it's easy to use. I also think it does a great job of making something that is very complex understandable by describing it in a simple scale of 1 to 5. So as we go through and we're wondering, what is heat vulnerability? How does it affect health? How does it vary from neighborhood to neighborhood? What does it have to do with racial inequities that affect New Yorkers? We can read about all of those factors. Oh, and median income as well affects heat vulnerability. And then we can enter in a neighborhood, populate that on the map, and then we can quickly get a sense of, okay, this neighborhood, which includes these zip codes, is much more vulnerable. It's a 5 out of 5 compared to other neighborhoods. And then we can also get this visual reference as well. So it paints a broad picture and then gets into specifics. Then just to quickly look at one of our data stories. So as mentioned, data are stories in themselves, and how we tell those stories can really determine how people understand, interact with, engage with all of these very important data sets that we work with and that we want you to be able to use and understand. So in order to make sure that data stories resonate, we try to use a variety of techniques to increase comprehensibility. So this one in particular talks about how economic stability and health are related, and we try to employ creative storytelling whenever possible. So we have some pull quotes here. Something really cool about this story is that it featured interviews with New Yorkers about how economic stability or lack thereof affected their health in all of these ways, and is related to unhealthy and unstable housing conditions, for example, which can increase exposure to weather-related illness, as well as financial stress, and which also might be related to food insecurity or energy insecurity, having to make difficult choices between paying energy bills, accessing medication, or being able to have enough healthy food to access. So as we go through this story, we can also see that we've used maps to visualize some of these issues, how like premature death, for example, rates are twice as high in poor neighborhoods as in wealthier ones. And also we feature these audio clips taken directly from interviews with New Yorkers. So we use these different techniques to hopefully help some of these stories really resonate emotionally, as well as for people to just take away the facts about these issues and be able to communicate about them and use them to advocate for greater health for all New Yorkers. Okay, and then let's quickly look at neighborhood reports and Data Explorer, and then we'll wrap this section up. So as mentioned, these are a snapshot into various indicators or data sets and how they compare across neighborhoods. So let's look at one. So this report is on asthma and the environment. So you can see as you go through here, we like to use comparisons a lot because they're a great way for people to understand exactly how an issue is contextualized within the city as a whole. So here we can see that this neighborhood has higher rates of asthma, higher rates of ED visits for asthma among adults, and hospitalizations as well. This also carries over to child asthma. And then we can also see that ED visits are higher as well for related to air pollutants such as PM2.5, fine particles, and ozone. So across the board, we can see how a lot of these health issues intersect and interact, how they're influenced, and how a population that might be more vulnerable to one health issue is probably also vulnerable to other health issues, which can help us inform better policy. Yeah, we can just see that this neighborhood experiences increased vulnerability to a whole host of things compared to other neighborhoods in New York City. We can get a quick sense of demographics over here on the left-hand side, as well as rankings and explaining what that means. And then we link to some resources. What is the city doing about this? What you can do, and then some related content here at the bottom. So we have 5 of these currently. We have one on active design and health, as well as climate, housing, and outdoor air. Oh, and I forgot to mention, if you click these drop downs, you can get maps and bar charts, as well as additional comparisons, borough-wide and also citywide. And then lastly, we have the Data Explorer. So yeah, really powerful tool for exploring these data sets and how they're related to health and the environment. So let's look at housing stability. So as the indicator loads here, you can take a look at data sets that are related to this indicator. So we're looking here at evictions. We can also see that household crowding, not having enough space for residents, owner-occupied homes, as well as rent-burdened households are all indicators you can explore in this topic. Here, you can read about housing stability and how it's related to health. You can go to more resources about housing stability. You can find some related data down here on the left. We link to this neat tool called, a name is escaping me, but contact your elected officials. Take action is the name of the tool. So here you can enter in an address and it will show you who your elected officials are, and it will give you their contact information. And then it will also link to the relevant 311 resource. So over here, I think earlier a couple of our presenters were talking about different geographies. Some of these are smaller, some of them are larger. Those will tell us different things about the city as a whole. So you can check and uncheck any of these geographies as is relevant to whatever comparison or whatever work you're trying to make and look into. And then you can look at these indicators on a map in most cases. You can also select certain years. You can look at all years. Here again, you can adjust neighborhood boundaries on the map. So we can see them at this larger geography of UHF 42, and we can also look at a smaller one like NTA's. We can look at a trend chart, which will include all years of available data. And then sometimes there's these correlates. So here we can see that evictions and depression among adults and how those two topics are related to each other. And something really neat here as well is if you're curious more about calculations and methods, there's additional information down here. You can also download not only like this particular view that I've selected with maybe 1 or 2 years of data, if that's what I need, you can also download every single thing that we have related to this data set. So that's really handy. And then you can take a look at the data on our GitHub repo here, copy the citation, and yeah, download it, visualize it, do whatever is helpful to you. Looks like we've got a couple questions, but we can get to those at the end. Anyway, that is kind of a quick overview of the Environment and Health Data Portal, and please feel free to reach out to us with questions if you'd like an additional demo or if you'd like to get our like semi-monthly newsletter. Thank you. And now, okay, you can sign up by just clicking the subscribe button on the top right side of the page. Okay, and now we will hear about the respiratory illness data page.
Hey everybody, my name is Hillary Parton and I'm the data team lead for our respiratory pathogens unit at the health department. And today I'm going to talk to you about our respiratory illness data page. Next slide. So to start off, I want to talk about what disease surveillance data are. These data include health information, which is systematically collected from a variety of sources and then analyzed and interpreted to inform public health action. And in New York City, if someone is diagnosed with a reportable disease or condition, healthcare providers are required to send that information to the health department. Next slide. Once the data get to us, there is a process because we have to clean and standardize that reported information so that we can use it to track diseases, inform our programs and policies, and prevent or respond to outbreaks. And it's important to note that our respiratory illness data that we post on these pages have some important distinctions from other communicable disease data available on the health department webpage. First, we update our data more often. We're currently releasing data every week on Thursdays, as opposed to annually for some of our other communicable diseases. And there is also less time between when we receive the data and when we post the data. And then the information that we present changes as our system changes so that we can share what is useful and relevant to the current situation. So now I'm just going to give a quick overview of what you can find on the respiratory illness data pages. So what you're seeing now is the landing page, where we provide an overview of recent trends and emergency department visits with a respiratory illness diagnosis overall, and with a COVID-19 flu or RSV diagnosis specifically compared with the previous week. And further down on our homepage, we also show information on emergency department visits and hospitalizations from the emergency department graphically, so you can quickly visualize the trends and have some context for what they look like compared with the past few months. We then have dedicated pages for each illness, where you can again see the citywide trend in emergency department visits and hospitalizations from the emergency department overall, and by demographic categories such as age group and borough. We also allow users to see trends in lab-reported cases during the current respiratory season compared with the previous 2. And again, we provide case counts for the last few months by demographic categories such as age group and borough. Next slide. On our COVID-19 page, we also have information on deaths, so you can see what those counts looked like compared for the most recent season compared with the previous 2. And again, you can look at that broken out by demographic group. And then for every graph shown on these pages, users can very easily download the data using the on-screen shortcut. Next slide. You can also visit our GitHub page, which will give you access to our full technical notes and data tables. And again, those are updated every Thursday. And that is it for me, so I will pass things over to Casey.
Thanks, Hillary. Hi, everyone. I'm Casey Seil. I am the Senior Director of the Office of Vital Statistics at the New York City Health Department, and I'm here to share some information about our provisional birth and death data page. It launched about a year ago. We actually did a preview of it at the Open Data Week last year, but now it's out there and ready for public consumption. Okay, great. So just to start with a brief overview about what vital statistics data are. So here at the health department, we're responsible for collecting data on every birth, death, and also terminations of pregnancy that occur in New York City. We have data going back more than 100 years, and one of our longstanding hallmark data products is our annual summary of vital statistics, and that's where this chart on the right is from. So this chart is showing one of the important indicators of a population's health that is calculated using vital statistics data, and that's life expectancy. So this chart shows how life expectancy has changed over time by some of the largest racial and ethnic groups in New York City over the past 10 years. And it's also an important indicator that is tracked for the Healthy NYC campaign, which is aimed at longer, healthier lives for all New Yorkers. So historically, it has taken us a while to release vital statistics numbers. There's a lot of good reasons for this, which kind of boils down to it takes a lot of work going on behind the scenes to make sure that the data are being reported to the health department in a timely fashion, that the data are of high quality such that we feel comfortable reporting the numbers out. And we also strive to use that highest quality data for our data products that are out there for the public to use. So here, that's the cover on the left of our most recent annual summary of vital statistics report. The most recent one is from 2023 and includes data from 2023. It came out only a few months ago. And also on the right is a screenshot of the EpiQuery tool that includes birth data currently through 2022. We're working on the 2023 data updates for that currently. But you can imagine that there are sometimes needs for more recent data than this. And the COVID-19 pandemic was a perfect example of that, where we needed to be sharing out data on deaths quickly to make sure that the general public was aware of what was happening during a public health emergency, and to help also identify the groups and areas of the city where there were elevated rates of those outcomes. That led us to the development of this new data page where we share 10 recent quarters of vital statistics data, and we update it on a quarterly basis. So this is what the visuals generally look like and has key indicators for births and deaths that occur in New York City. And we stratify these numbers by some of the characteristics that we know that people find the most useful. The data are also available for download in a GitHub repository that is linked on the page. And overall, the goal is to allow data users to have a sense of more recent data patterns than what is otherwise available a lot of times. But part of what we do on this page as well is to educate the data user of what it means for data to be provisional, largely meaning that they're subject to change. And so we feel that this data page represents a balance between pretty high quality and mostly complete data, but with the timeliness that people are seeking. And we also referenced some existing data tools when we were scoping out how to build this, most notably the National Center for Health Statistics Rapid Release Dashboard, which is a really nice one too that you may want to check out. So next slide. Great. And so, so these are a couple other sections on our page for birth characteristics, for example, Medicaid covered births versus non-Medicaid covered births. And then this deaths visualization on the right side is a particular favorite because you can click the different causes that you're interested in, turn them off and on the chart. So I'm handing it over to Alexa now. Thank you very much.
Thanks so much. Since we're nearing the end of this session, I might speak quicker than the rest of my colleagues. So I'll jump into the Childhood Vaccination Data Explorer. My name is Alexa Riggs, and I'm a data analyst within the Bureau of Immunization, and that's where our data source lies for the Vaccination Data Explorer. Our mission at BOI is to prevent the occurrence and transmission of vaccine-preventable diseases through immunization. So part of that mission is capturing all vaccination data
administered to New York City children 0 through 18 years old as part of a registry that was developed in 1997. And so again, after immunization data for children receiving immunizations in New York City, and then verbal consent is required for adults 19 years and older. So that is our data source for the Vaccination Data Explorer, which we launched in June of last year, 2025. And the public-facing Data Explorer provides vaccination coverage data for New York City residents to use, explore, and to see themselves in data. All of the visuals on the website that we'll go over are accessible with interactive features. And at the moment, we have vaccination coverage for 10 vaccine groups. And I will go ahead and share my screen and jump into exactly what that looks like. So here is the landing page. Martha went over how to find in the data interact and visualize page. And I'll scroll down so you can see about the vaccines. So I'll just click measles, mumps, rubella for an example. If you were to click MMR, you'll see that you have it highlighted here. You can scroll down, get a little bit more information about MMR, when the vaccine is recommended to be administered, among what age groups. So here we're looking at 2-year-olds by their 2nd birthday, and then some information about what coverage is right now. So as of December 31st last year, 2025, 89% of New York City children by 2 years have at least one MR dose by their 2nd birthday. And so here's just a trends over time graph. We have the similar graph for all of the vaccine groups that we display. So about 10 vaccine groups at appropriate ages. And I'll keep scrolling down so you can see the next visual, which is vaccination by race ethnicity. So again, we're looking at MMR, citywide coverage, 89%. And then if you're interested in one race ethnicity subgroup, for example, Hispanic Latino, you can see 88%. And I'm just going to make my web page a little bit wider. And if you scroll down, now you can see vaccination MMR for zip code represented in maps. So you can see the map, and then you have this button on the left for the year and month. At the moment, we have 10 snapshots of data available. So 10 year and month or year and quarter combinations. So again, by default, we're looking at the end of last year, December 2025. And if I were to click a neighborhood like Chelsea, I could see the zip codes, the estimated population, and then our coverage. So we're estimating 99% of children in that area. I'll keep scrolling down, and then I can see a borough-wide estimate, which is just the same information. But if you weren't interested in the zip code area, you could just look at it at the neighborhood level. And I'll just go over a few more features of the page. You can download the information by hitting get the data on the right-hand side. So if you click, you'll see a little pop-up around the get the data button. You can go ahead and click, Emily. So you'll see that red. And then if you were to actually click that in real life, you'll see a little pop-up, which is how you can take you to the actual raw data. And it's as simple as just right-clicking and saving as a CSV file or your preferred method. So that's how you can download the data. And the information is available on GitHub. We can skip that one. We update it twice a year. We assess coverage or vaccination data at 2 time points, June 30th and December 31st. And one quick limitation of our data is that we're working with population estimates for all of New York City, which is from the census and New York City Department of Planning. So our population estimates, you can imagine, for the whole city and subgroups are constantly changing from births, deaths, people moving in and out of the city. So for that reason, we have to revise and edit our coverage estimates. So the information on the webpage is subject to change, which is a nice little callback to the earlier presentation. And here's our QR code to access the VDE. Thanks so much. Sorry I didn't leave much time.
Yeah, thank you, everybody.